Go ahead, ma'am.
அனைவருக்கும் வணக்கம். நான் டாக்டர் ஹேமா வைத்தியநாதன், சீனியர் ஃபர்டிலிட்டி கன்சல்டன்ட் at Oasis Fertility, Chennai. ஸோ நம்ம வந்து இந்த செஷன்ல IVF ட்ரீட்மெண்ட் பத்தி ஸ்டெப் பை ஸ்டெப்பாக வந்து தெரிஞ்சுக்கலாம். ஸோ இதில் வந்து ஸோ ஐவிஎஃப் ட்ரீட்மெண்ட் அதை பொறுத்து வந்து ஸோ இட்ஸ் நாட் ஒரு நமக்கு எல்லாமே தெரியும், இட்ஸ் நாட் அ சிங்கிள் ஸ்டெப் ட்ரீட்மெண்ட் இல்லையா. ஸோ இது வந்து ஒரு ஸ்டெப் பை ஸ்டெப்பாக நடக்கிற ஒரு ப்ராசஸ். ஸோ இந்த ஐவிஎஃப் ட்ரீட்மெண்ட்ல வந்து இருக்கிற முக்கியமான ஸ்டெப்ஸ் பற்றி நம்ம கொஞ்சம் டீட்டெயிலாக வந்து. ஸோ ஃபர்ஸ்ட் ஸ்டெப் அப்படின்னு பார்த்தோம்னா இன்ஜெக்ஷன்ஸ் அண்ட் தட் இஸ் கால்ட் ovarian stimulation சொல்கிற ஹார்மோனல் தெரப்பி. ஸோ திஸ் ovarian stimulation and then usually it is followed by an egg pickup procedure. And after egg pickup procedure, then the fertilization process is started, which is either an IVF procedure or an ICSI procedure. So once fertilization step is done, then it is embryo culture. So embryo culture அப்புறமா நடக்கிற ப்ரொசீஜர் வந்து embryo transfer. ஸோ இந்த மாதிரி முக்கியமான நிறைய ஸ்டெப்ஸ் வந்து ஐவிஎஃப் ட்ரீட்மெண்ட்ல இருக்கலாம். ஸோ இதை பற்றி புரிஞ்சுக்கிறதுக்கு நம்ம இதை ஸ்டெப் பை ஸ்டெப்பாக வந்து நம்ம இன்னைக்கு தெரிஞ்சுக்கலாம். ஸோ ஐவிஎஃப் அப்படின்ற ட்ரீட்மெண்ட் வந்து ஒரு அட்வான்ஸ்டு ஃபார்ம் ஆஃப் ஃபர்டிலிட்டி ட்ரீட்மெண்ட். ஸோ ஐவிஎஃப் வந்து இண்டிகேஷன்ஸ் அதே. ஸோ ஐவிஎஃப் இண்டிகேஷன்ஸ் அப்படின்னு பார்த்தோம்னா சில கப்பல்ஸ்க்கு ஸ்டெப் பை ஸ்டெப்பாக வந்து ஆஃப்டர் தேர் ஃபர்ஸ்ட் லைன் ட்ரீட்மெண்ட், செகண்ட் லைன் ட்ரீட்மெண்ட் வந்து ஃபெயிலியர் ஆகும்போது ஐவிஎஃப் ட்ரீட்மெண்ட் வந்து சஜெஸ்ட் பண்ணுவோம். அதர்வைஸ் வந்து ஃபார் சம் கப்பல்ஸ் வந்து ஐவிஎஃப் மேபி ஆஃபர்ட் ஆஸ் ஸ்ட்ரெயிட் அவே ஆஸ் அ ஃபர்ஸ்ட் லைன் ட்ரீட்மெண்ட். ஸோ யாருக்கெல்லாம் வந்து ஐவிஎஃப் வந்து எடுத்த உடனே வந்து ஃபர்ஸ்ட் லைன் ட்ரீட்மெண்ட்டாக தேவைப்படும்னு பார்த்தோம்னா, ஸோ விமனுக்கு வந்து ரெண்டு சைட்லையுமே வந்து டியூப்ஸ் வந்து பிளாக் ஆகிருக்கும் பொழுது, அதர்வைஸ் வந்து எண்டோமெட்ரியோசிஸ் அப்படின்ற கண்டிஷன் வந்து ஸ்டேஜ் 3 ஒரு ஸ்டேஜ் 4ல இருக்கும்போது, இல்லைனா வந்து மல்டிபிள் வந்து IUI சைக்கிள்ஸ் வந்து ஃபெயிலியர் ஆகும்போது, இல்லைனா வந்து மேல் ஃபேக்டர்ல வந்து சிவியர் ஸ்பெர்ம் அப்நார்மாலிட்டிஸ் வந்து சிவியராக இருக்கும்போது வந்து ஃபர்ஸ்ட் லைன் ட்ரீட்மெண்ட் இட்செல்ஃப். ஸோ ஐவிஎஃப் இண்டிகேஷனை பொறுத்து வந்து ட்ரீட்மெண்ட்ஸ் வந்து வேரி ஆனாலும் ஐவிஎஃப்ல சம் ஸ்டெப்ஸ் ஒரு காமன் ஸ்டெப்ஸ், தென் கன்வென்ஷனல் ஐவிஎஃப் சைக்கிள் ட்ரீட்மெண்ட்டோட ஸ்டெப்போட ஃபர்ஸ்ட் ஸ்டெப் controlled ovarian hyperstimulation. So conventional stimulation வந்து usually you are given injections. The injections are usually preparations of FSH and LH அப்படின்னு சொல்லக்கூடிய ஒரு ஹார்மோனல் ப்ரிப்பரேஷனாக இருக்கும். So இந்த injections are usually administered and these injections are actually they only act on the ovaries. So ovaries it acts on the ovaries and it stimulates the follicles to grow. So in the madri, as you can see in this picture, is the ovary at rest when it is not stimulated. So all the follicles are at rest. So when injections are administered during an IVF cycle, the ovaries are stimulated and we allow multiple follicles to grow. So by administering these injections, and these injections are called as usually the gonadotropin injections that contains FSH and LH as a hormones. So controlled ovarian stimulation involves taking injections, and the duration of injections usually depends on the type of problem that you have, and usually depends on the ovarian reserve you have. So the dose and the duration of the injections that you need cycle to cycle and varies between patients. So after you take the injections and the ovaries are stimulated for the multiple follicles to grow, and this cycle is usually very much monitored by both ultrasound as well as by sequential blood tests. So we are monitoring the cycle so that to understand how safe the cycle is going and how effectively the cycle is going. So we want to understand how much of follicles are growing, how the maturity is, and also to decide on the dose that we can administer for you. So it's usually monitored by ultrasound and blood test of hormones, and usually at the end of the stimulation, a final injection known as a trigger injection is administered, and this trigger injection is given to do the final maturation of eggs. So after final maturation of eggs, usually you are ready for the next process, which is the egg retrieval procedure. So this egg retrieval procedure usually involves collection of the follicular fluid from inside the follicles. So as I said before, in a natural cycle, you only ovulate and develop one single follicle known as the dominant follicle, and then this follicle it ovulates and releases the mature egg. When this happens in a natural cycle, whereas in a cycle with ovarian stimulation is happening, there are multiple follicles that develop, and then the multiple follicles and then their mature oocytes are collected by the procedure. So when also the type of response can vary, because this, as you can see, it all depends on the ovarian reserve that you have. So sometimes women show a low response even with a good number of injections. In that case, we call it as a low response. If you have a normal response, we call it a normal response. Some patients will respond with growing more number of follicles. In that case, we call it as a high response. So as I said, this egg retrieval procedure usually follows the stimulation injections, and after you have taken your trigger injection. So egg retrieval procedure is actually a small minor procedure done under anesthesia to collect the eggs from the ovaries. So usually it is done under transvaginal ultrasound guidance. So as during a transvaginal ultrasound procedure, so the needle also will be injected with the scan guidance, and the needle will be inserted into the ovarian follicles so that we apply some suction and aspirate only the follicular fluid. And along with the follicular fluid, the egg also get aspirated. And this egg follicular fluid will be screened in the IVF lab, and then the embryologist can pick up the eggs that are being collected during the procedure. So this procedure is a simple procedure done under anesthesia mostly. So it involves collection of follicular fluid from both the ovaries, and then the follicular fluid will be screened in the IVF lab by the embryo. So we'll get to know how many mature eggs are there, and after the IVF, the embryologist process the collected eggs, which is usually known as the cumulus oocyte complexes. So as you understand, the follicular fluid will be aspirated, and the follicular fluid will be put in a dish and screened under a microscope to pick up the eggs that we have collected. So when this is the egg retrieval procedure, so once the eggs are collected, then the outer layer of the eggs are usually cleared up by a process known as denudation, and then we see the maturity of the egg. The mature eggs will look like that under a microscope, as you can see. It is a spherical structure. It has a good outer layer, and this area is known as the cytoplasm of the egg. And then usually we screen for the maturity of the egg by many different parameters, and one such thing is seeing a single polar body. So this is a mature human egg will look like after the outer layer of the egg is removed. So once the mature eggs are being collected, so then the next process will be to do the fertilization, and embryo culture is the next step. So as you know, fertilization process can take place by two steps or two processes in an IVF lab. One is the in vitro fertilization type, and other is the ICSI type. As ICSI is the intracytoplasmic sperm injection type. So in IVF process, so if there are no semen abnormalities, the sperm and the egg can be placed together in a dish, in a culture dish in the laboratory, in the incubator. Then the sperm is given a chance to fertilize the eggs on its own. So this process is known as the IVF process. And if there are any sperm abnormalities, then ICSI process will be suggested for you. So ICSI process is intracytoplasmic sperm injection technique, where, as you can see in this picture, the egg is held with a pipette, and then after it is held, then the sperm is loaded in a small micro injector, and then the sperm is put back straight away inside of the egg, so to allow for the fertilization to start. So this process is an ICSI process. Majority of the centers throughout the world, they follow ICSI process, and both IVF and ICSI process can be done in a single cycle also. It depends on the patient factors also. So once the fertilization process is started, as I said, the IVF involves putting the sperms and the eggs, mixing it and putting it in a dish in a culture media, so that we can assess the fertilization the next day. So you also have to understand the embryo culture process in the IVF labs, where on the next day after the fertilization process is initiated, the next day the fertilization check is done to assess if the fertilization of the egg had happened. In that case, the fertilized egg is known as the zygote stage of the embryo formation. And then after that, there is cell division process. It happens like this. So this all happens in the culture media inside the incubator. So these are the stages. As I said, zygote is a stage of a fertilized egg. And after that, it started dividing and making cells, and then the cells divide into more, and then it forms a morula stage, and then the blastocyst stage. So usually, human embryos can be cultured only until the blastocyst stage, which can be usually in the day 5, or sometimes it can take up to day 6 and day 7. So this blastocyst stage of embryo is what the preferred stage of embryo development in the IVF lab also. So after that, as you can see, the day 1 embryo look like that. The real human fertilized egg looks like this, with the two polar bodies, as the medical term. The polar body is seen on the outside, and then the male and female pronuclei are seen like this. So this structure is identified as the zygote. As I said, this is what the fertilization and the further embryo development looks like. It goes to a 2-cell stage, 4-cell stage, 8-cell stage, and then it goes on to a stage known as a stage, and then it goes to develop as a blastocyst embryo on day 5 of culture. So this blastocyst culture is what is the preferred culture in IVF cycles. So as I said, once the blast formation is and blast culture is done, we need to assess the embryo quality also, because embryo selection process is very important, because we need to select a embryo with the good implantation potential so that we can increase the success rate in one IVF cycle. So we need to assess the embryo quality of the blast in order to select the good quality blast. So how do we look the embryo quality? It's because we assess the embryologist assess the cells. This cell on the outside of an embryo. So this embryo is actually, the blast embryo look like a ball of cells. So it has an outer layer which is known as a trophectoderm layer, and then there is an inner layer which is inner cell mass. So this is what is the inner cell mass inside the blastocyst look like, and this is what forms the baby, forms the fetus. This trophectoderm layer that you see on the outside is what forms the placenta. So when we are grading the embryo, the embryologist uses several parameters to assess the number of cells and the adhesion between the cells, and how grouped and clumped they are, and how compact they are, and how much expanded the embryo is, and how the blastocyst cavity is also. So inside is what is a blastocyst cavity. So there are so many parameters assessed to understand the quality of the embryo in order for us to select a best quality embryo to transfer for you in the next embryo transfer cycle. So next, this is what is the grading of these embryos goes like this. So we want a good expanded blastocyst of an AA quality usually. There are other different grades as vary, as you can see. The cells may be, few cells may be there, and some cell in the cell mass may not be properly formed. In that case, it is categorized as a CC type of blast. So you have to understand that there is grading of blast. Not all blast are of the equal quality. So the embryologist does an extensive assessment to grade your embryos so that we transfer a better quality embryo for you to give a best success rate in your cycle. So next comes the understanding that there are 2 types of transfers available. You can even get transferred your embryos on day 3 itself, or sometimes you can allow for a day 5 transfer also. But most importantly, preferably day 5 or the blastocyst stage of embryo transfer is the preferred method of embryo transfer. So this is what is the day 3 transfer will look like, where the cells, where the embryos, when they are in the cell stage itself, they are transferred. Usually, this is how a day 3 embryo will look like. Will have an equal number of cells. These cells are called the blastomia cells, and they have an outer zona pellucida. So this day 3 embryos can be transferred, but preferably, as I said, blastocyst stage transfer is the preferred stage of embryo transfer. So this is what a blastocyst will look like. So it is better for a blastocyst transfer so that we know we can increase implantation potential of that embryo. So next step, after the embryo is formed, after blastocyst is cultured, and after we understand the grading, so it's then the embryo transfer process can happen. So embryo transfer process involves of the embryo that is very small, soft, thin catheter, and this catheter is passed very gently, asymptomatically into the uterus, and then it is put back inside of the uterus where to allow for implantation to happen. So this embryo transfer procedure is usually done without anesthesia, and it is usually done as a transvaginal approach by a small catheter. So embryo transfer can be a fresh embryo transfer when the embryos are put back in the stimulation cycle itself, or it can be a frozen embryo transfer where the embryos are cryopreserved and then transferred in a later cycle, in an unstimulated cycle. So this is what during an ultrasound guided embryo transfer will look like. The embryo transfer catheter goes like this, and then the embryo is deposited in the upper part of the uterus, where the patient also can see the air bubbles being deposited along with the embryo. The micro drop can be visualized by scan so that we understand the placement of the embryo, and then the catheter is slowly withdrawn, placing the embryo on the top of the uterine cavity. So usually embryo transfer procedure is done under ultrasound guidance, and usually anesthesia is not necessary. So once the embryos are placed, you will be allowed to do your pregnancy testing, usually after 2 weeks after your embryo transfer. So let's speak about the additional IVF procedures that are available. So these procedures are known as the add-on procedures of IVF. So some procedures may be suggested for you on a case-by-case basis, depends on the underlying problems. For example, cryopreservation of embryos, it's a very standard procedure that is involved where the excess embryos are always frozen and for later use. And then one other add-on procedure is a laser assisted hatching procedure, so which involves making a small gap in the outer layer of the embryos. So this embryos gets a better implantation because of this embryos, if they have a very thick outer layer, sometimes it may impact the implantation process. By laser assisted hatching, for selected cases, it helps because we create a gap in the outer layer so that to help in a better implantation. This is also needed in selected patient groups. Next, about the add-on procedure, which is microsurgical sperm aspiration and then testicular sperm extraction. There are a lot of other sperm extraction procedures available. This is available for couples where the male cannot, they do not have sperms in the ejaculate. Then this type of procedure is suggested, so that we take biopsy of the testicular tissue, or sometimes an aspiration of the testicular fluid or the epididymal fluid to collect the sperms as a surgically retrieve the sperms and use it for the HC procedure. So testicular sperm extraction or epididymal sperm extraction or aspiration is available as a surgical procedure for men when they cannot produce sperm in their ejaculate, so that we give them a chance to use their own sperms during their IVF cycle. Another add-on procedure and the most popular procedure nowadays is to undergo a genetic testing of embryos, and this process is known as the pre-implantation genetic testing. So pre-implantation genetic testing, as you understand, so it involves taking biopsy of few cells from the embryos. So there are various indications why add-on testing will be offered for you. So some of the indications that we suggest for couples to take PGT testing is when the maternal age, when the woman's age is advanced, more than 35 years, there is more chance that the equality is low, and so that the embryo quality is also impaired. In that case, PGT, by testing the embryos and then implanting the better quality euploid embryos, can result in a better success rate per cycle, and also it reduces the chance of miscarriages. And the other indication that we suggest pre-implantation genetic testing is when the male factor problem is severe. So sperm abnormalities appear very severe. If the sperm count is less than 5 million, or sometimes if the morphology of the sperm, the shape of the sperm is totally abnormal, or the sperm quality is poor overall, we suggest PGT for specific couples so that it increases the chances of a success per cycle. So why pre-implantation genetic testing is also suggested for couples like couples with recurrent miscarriages. So recurrent miscarriages, when 2-3 miscarriages happen in a row, we call it as a recurrent miscarriage. So when there are more than 2 miscarriages, the more common chance why, the reason why miscarriages happen is because of chromosomal abnormalities in the fetus. So, so for a couple who is experiencing recurrent miscarriages, pre-implantation genetic testing is usually offered as an add-on procedure, because by doing a pre-implantation genetic testing, we are able to identify embryos that are not chromosomally abnormal, so that we identify euploid embryo, which is known as a chromosomal normal embryo, have a better chance of implantation. And not just that, it also reduces the miscarriage rate because of chromosome. So as I said, couple having recurrent miscarriages are candidates for undergoing this pre-implantation genetic testing. Apart from that, couples who are experiencing repeated IVF cycle. So when the outcome is poor, we suggest to undergo pre-implantation genetic testing also for that couple who are experiencing previous IVF failures. Because one of the reasons why implantation fails is because the embryos is not of good quality, or even if it looks normal, it may be genetically abnormal. So it is important we identify the genetic makeup of that embryo in order for us to select a normal embryo for a better implantation and less miscarriage in that cycle. So hence, for couples with repeated IVF failure or a repeated implantation failure also, pre-implantation genetic testing is offered as a add-on procedure. So these are we spoke about the indications why PGT is offered for couple cycles, and PGT is not necessary in all IVF cycles that we run. It is indicated for selected couples. So as I said, the benefits are we can identify here chromosomally normal embryo, euploid embryo, so that we give you a better chances of implantation. So we come to the end of the session. So I think I've covered the IVF steps overall. So the conventional IVF cycle runs like that, with stimulation, egg collection, embryo culture, and transfer. Because there are so many other modifications to it. So there are other type of IVF cycle that we can run, like a short protocol or a random start IVF cycle is available. Or sometimes the other type of IVF cycle available is the in vitro maturation type of IVF cycle, where no stimulation is usually necessary. So there is no need to take IVF drugs for a longer time. So it involves collection of the immature eggs itself, and then this immature eggs can be cultured in the lab, and then the embryos can be transferred. So this is an in vitro maturation type of IVF cycle. So there are different types of how IVF cycle can be done. The conventional IVF cycle only involves, as I said, stimulation, egg collection, and then embryo transfer process. So let me see if I have any questions for answering. So I have this question, which step in IVF is painful? So usually IVF is a patient-friendly procedure, it's only. So even if the injections that we give are only mostly a subcutaneous injection, which is given under the skin only, and not deeper or painful injections are given. So but the painful procedure as such is only the egg collection procedure, which involves transvaginal collection of eggs. But even because it is painful only, we prefer to do it under some form of anesthesia. We preferably give a mild general anesthesia during the egg collection procedure. So, but though it is painful, we do it on anesthesia for it to be easy. Otherwise, IVF as such is a patient-friendly procedure and a painless procedure only. So, next question is, so what are the 3 types of IVF if been asked? So, the type of IVF differs vary on the type of injections and the type of the protocol, as we call it, and also it varies by the type of fertilization. As I said, it varies between IVF and the EC cycle, and also it varies between fresh embryo transfer and frozen embryo transfer. So the type of IVF differs at every step of your treatment. So it actually decided on a case-by-case basis. Usually it is based on the age of the couple as well as the reason why you are having the infertility problem. The next question is, so what is the success rate of IUI in the second attempt? So IUI, as you understand, is a procedure known as the in vitro insemination procedure. So insemination procedure involves we transfer the prepared and washed semen into the uterine cavity, so that there's a better chance of the sperm meeting the egg, because we time it also on during an ovulation time. So the success rate of IUI, it depends on the reason why we are having IUI per se. So usually the sperm quality, the sperm count is better. We call it as a total sperm count. If it is better after your sperm is being washed and prepared, if it is good, it gives a better success rate. And also, if the ovulation, if you have stimulated and you are ovulated 2-3 follicles have been grown and your ovulation is good, and your IUI is timed around your ovulation time, then IUI give a better success rate. Usually IUI success rate is around 15%, that is 15 couples conceive in their IUI cycle out of 100 couples in the first IUI cycle. And also second attempt also gives a similar success rate. Usually IUI has to be done at least 3 times to 4 times to give a better success rate. The next question is, does IVF have a lot of side effects? So IVF, as I said, has become a very simple and a patient-friendly procedure. So there is even couples have very much concerns about the injections. So they ask us whether the injections have side effects and long-term side effects. Usually IVF injections, as I said, it only acts on the ovaries to stimulate your follicles, or it acts on the uterus to prepare the endometrium for implantation. And also usually hormone injections are given to suppress fibroids and endometriosis and other conditions. So most of the time it does not have any other side effects, and they are also not very much painful injections. Usually side effects or not major side effects during your IVF treatment, and even long-term side effects. One of the main concerns is whether the onset of premature menopause or onset of cancer. So this is the major side effects that the patients are concerned. But a lot of research studies have proven that because you're taking IVF treatment repeatedly, it does not increase your chance of having a premature menopause. Also, IVF injections or IVF treatment multiple times doesn't increase your chance of having a ovarian cancer or an uterine cancer. So a lot of long-term research studies have proven that IVF treatment is not associated with long-term problems. So thank you all for your patient listening. So we reached the end of the session. So please contact us if you have any